Acuity's mission is very similar to those of our clients. When it comes to the clinical revenue cycle, they want to ensure that they're getting the most accurate and compliant reflection of the care that was delivered in the medical record. And so our whole mission at Acuity is to support that.
Acuity value proposition started back in 2014 by a few physicians from the Mount Sinai Health System. We started looking at the coded abstracted data versus the clinical abstracted data, and we noticed there was a discrepancy when it came into that quality metrics that we were trying to put together, and realized that we are leaving a lot of financial value behind us. Acuity model is unique. It's really physician-led review process. You pair a doctor with a certified coder to review the chart with the support of a certified CDI specialist. The process happens after coding is completed, after the patient has been discharged, but before the bill has been dropped. Think of Acuity as a safety net. We're not there to disturb the client or the facility mid-revenue cycle team or operations. We're there to be as an added resource for them with the physician help in order to optimize the code and to truly reflect the true clinical picture of why the patient was admitted and hospitalized and required the resources that he did. In order to capture the proper, accurate, and complete coding, you really have to understand physician documentation and understand the complexity of the patient care that occurred and the resources that were utilized for the care of that patient as well. Who's better than a doctor to understand another physician's documentation? That's the unique part where our physicians are bringing their clinical expertise, their understanding of the pathophysiology of the illnesses and diagnosis and admitted disease principles in order to really reflect it in a proper way for proper.
So really, if you think about Acuity, we were built by healthcare for healthcare at a health system. And that's kind of how we started. And that's really been the underpinning of everything we think about. At the end of the day, we're here to help hospitals serve their communities and make sure that they're getting the chart as compliant as possible and accurate as possible to get reimbursed as accurately as possible.